my name's Danielle McGeary, for those of you who don't know me. I know I recognize a lot of you in the audience, but thank you for coming out to hear me speak this morning. We love our friends at MD Expo. Thank you for having me and always inviting me to your events. I love to get out to these when I can, along with all of the regional associations. So like Jeff said, I started in this field troubleshooting infusion pumps on my Christmas break in college and just worked my way up from there. So I have also done the work, and I'm just honored to be in this position at AAMI now. Is this the clicker? Okay. So for those of you who aren't familiar with AAMI, we stand for the Association for the Advancement of Medical Instrumentation. We have about 11,000 members who pay to be a member of our organization, which is comprised of manufacturers, clinicians, HTM professionals, sterilization professionals, educators, regulatory bodies, and the majority of our members, our corporate members, join AAMI to have a voice in standards development. And we're going to talk about that a little bit more. We reach about 65,000 healthcare technology professionals each year. And that happens because, people come to our exchange. Maybe some people have a certification, but they aren't necessarily a member. And we're small but mighty. We're only 48 people, and the majority of our staff are standards developers. So why would you want to work with us? So there's a lot of misconception about what AAMI is and what AAMI isn't. We are not an HTM organization per se, even though we have an HTM vertical. We are a standards developing organization focused in the safe and effective use of health technology. So we are accredited by ANSI, which is the American National Standards Institute. Without that, we wouldn't be able to develop standards. And what we do is we serve as a neutral convener. We bring people together from all sides of health technology. So love us or hate us, because we are a standards developing organization, we are neutral and we cannot lobby. So we do not get involved with anything political. So things like right to repair, credentialing, even at the state level, we cannot get involved in anything political. That doesn't stop you guys from doing it, but we cannot be lobbying with you all. But how we make change is through our standards development. So if there's a problem, a safety issue, we can develop a standard to help solve that problem. So we are looking at doing like a servicing standard for the servicing of medical equipment to make sure equipment is being serviced safely. So that is, we are obviously helping to ensure the safe servicing of equipment, but we are not lobbying. Standards can be adopted into law, that like NFPA 99, if you've heard of that. That would be a standard that is taken off and really been adopted everywhere. The thing about standards is they're voluntarily adopted. So AAMI cannot push or require the field to adopt standards, but that's where you all come in. You probably use our water quality standards if you work in the dialysis department, ST79. You've probably heard of us from that, and we do a lot of central processing standards as well. So beyond HTM, when we talk about this, we have three distinct verticals within AAMI. I obviously represent the healthcare technology management vertical. I won't explain what that is. You all know what that is. We have our industry vertical, which is manufacturing, the development, the packaging, all the way back to when it's just a concept, when it's in research. We have standards all around that. And then we have sterilization, which is split between healthcare and industry. We have sterile processing standards, as you know it, in hospitals, so the reprocessing of tools. But we also have packaging and industrial sterilization standards. So when stuff leaves the manufacturing plant, they want to get to the hospital sterile. So that includes the packaging there, the transportation, and all of that. So we cover a lot more than just HTM, and we're always looking for volunteers to be on our standards committees. It's really a way to make a difference, and it's really a way to share your expertise. So as we're developing these documents, your voice is heard. Now, if you don't have time to get involved and be committed to a standards committee, we have about 200 of them at AAMI, so we do a lot. And we touch about 800 standards a year, because there's ISO. I know in HTM, that's Independent Service Organization, but in the standards world, it's International Standards Organization. So you ISO 13485, standards like that. So we touch those and get involved with all of those as well. So I think we talked about this. We also work closely with the FDA. We co-teach a lot of industry courses with the FDA, and they're involved in someone from the FDA sits on almost every one of our standards committees as well. So we're heavily involved with them, just so we're all aligned. In standards, it's very formal. It's not like just creating a guidance document. We have a standards governing body that approves a new standard when it comes through. Then we create these multidisciplinary team that has equal representation from all sides. And then they start writing these documents. The committee itself has to vote and approve it. If it doesn't, they revise and go back. And once you get through that, then it goes out for public comment. So the public does weigh in on all of our standards. So even if you don't have time to formally be on a committee, make sure you're going through our website on our standards monitor and you're looking at our standards and you're providing comment, because it's so important. And ANSI does require us to respond to every comment. So, you know, we may not take your comment, but we have to at least respond and consider it. So like we just wrote a standard for AEM, alternative equipment maintenance. You know, if someone wrote a comment saying, you know, I don't think there should be research before we put things on AEM. You know, we obviously would thank them for their comment and move along, but we have to acknowledge that. So these are just kind of everything that we do around standards, quality systems, general safety, software, nomenclature, patient monitoring. And then new areas of focus is obviously AI, robotics, mobile apps, consumer devices, cloud computing, cybersecurity, interoperability. So we have a lot of standards that we touch every single year. And standards specific to HTM, I am at table 114. I forgot to say that. I have examples of these standards at the table. So if you want to come check them out, I have examples at the table and I'm happy to talk in more detail about them. But we have EQ 56, which is basically the MEMP, the Medical Equipment Management Plan standard, and the quality standard. It was just updated last year. And let's see, EQ 89 is the use of medical equipment maintenance strategies and procedures. So this is the guts of what we do every day. EQ 93, which is your vocabulary standards. So we define key terms like remanufacturing, repairing, and reprocessing. Those 3 R's are very important. Obviously, we never remanufacture. We don't re-engineer the device. It should go back in service with the intended use that it was created for. EQ 103 is the AEM standard that just came out last year. And EQ 110 is a standard for HTM academic programs. So what students coming out of 2-year HTM academic programs should know for competencies. So let's go back to the is there any questions about any of that before I move on? It's a small group, so if people have questions, I'm fine if you raise your hand. It can be interactive. I know standards is a riveting topic. So HTM strategic goals. So if we go back to my vertical, the HTM vertical, these are our 3 goals: to promote, elevate, and standardize the HTM field. We're going to talk about a lot of the work we've done in the past 5 years at AAMI. So in 2021, we did an HTM demographic survey to kind of get a lay of the land and what we were looking at when we think about diversity in HTM. We know we have an aging workforce, but we didn't really have data to really substantiate that. And the engineer in me doesn't like to make claims without having data to back them up. So in 2021, we found that there's about 7,000 respondents, so it's a good subset of the field. Only 10% of the field was female, but 14% of the field managers were female. So that's really positive. It shows that the women in the field are being retained and they're having a positive career trajectory. 8.5 are African American, 7.3 Hispanic. Over half the field is over the age of 50, and 65% of our managers are over the age of 55. So this kind of leads into a lot of the strategic decisions we've made in this HTM vertical at AAMI over the past few years. We did just put out a state of HTM survey that closed October 31st, but we're hoping to get some updated data this year. So that data will probably be released at the beginning of 2026. So when we look at, the aging workforce and the mass retirees, we compound this with a problem that there's not many HTM specific academic programs across the country. There are currently 26 states in the country that don't have any HTM specific academic program at all. So the blue ones are all the two-year biomedical technology schools. The green one is the College of Biomedical Equipment Technology, the online school. There's a second one, there's a second online school as well. And then the red ones are they offer a 4-year degree in biomedical technology. And sorry, the yellow ones, and the red ones are the graduate programs at the University of Connecticut in Marquette. So what is problematic about that is that if there's no HTM specific academic program near you, how are you going to hear about it if you aren't out, recruiting, promoting the field and doing it yourself? Because you're not going to organically get people. Since I've started at AAMI, we've seen about another 24 HTM academic programs close. A big part of that was DeVry, that they had 13 programs across the country, and when DeVry got rid of their program, that's 13 of them, but then there's been a lot of other ones. AAMI is very involved. We do have an educators committee for those programs that want to be involved with us. All their students get free AAMI memberships. Their educators, if they get 10 students, get free memberships with AAMI. We try to really get them engaged. We have a scholarship program through the AAMI Foundation. We give out about 15 $3,000 scholarships every year to folks studying in HTM careers. And if they win that scholarship, the donors were very generous. They also fund those students their complete travel to the AAMI Exchange so they can accept that award in person and come as well. So we do have that as well, but we're trying really hard to really create a bigger pipeline. And I've written multiple letters to deans trying to stop these programs from closing. But the problem is, much like our businesses, their programs need to generate revenue to stay open. And when they have to make cuts, they're going to look at the programs with the least amount of enrollees. And unfortunately, a lot of times that's the biomedical technology programs. And I think we all have a responsibility to really get out there and really help promote the field. I always say leaders give back to the field that they serve. And I think this is a perfect opportunity for all of us to get up and do that. And then we'll talk about some of the resources we have to make it easy. But, I often give a keynote about leaving your legacy. And I feel like there's no better legacy than influencing the next generation. We often feel our jobs are thankless getting out there and promoting the field, because you may talk to a group of, 3rd graders now, and well, it's not measurable. You'll never know. But, you're spreading awareness. One person talks to another. We did a Girl Scout Day in New Hampshire, and we had a lot of parents come out and talk to us too. So you just never know the impact you're going to leave. So, it might not always be measurable, but it doesn't mean that it's not important. So talking about, promoting the field, we have a succession planning guide. Succession planning is very, very important. Obviously, we know there's going to be a mass exodus of people in the next 10 to 15 years. You need to have a plan of how you're going to replace them. This guide has a whole spreadsheet where you can go through everyone on your staff, whether they're a BMed or a manager, it's for anyone, and you can talk about what are their competencies, what competencies do they need to get to the next level. Folks, when we talk about retention, is also going to be important, because as people start retiring, new job opportunities are going to open up, and you're going to see this musical chairs of HTM professionals, because if they want a promotion and there's not one where they work, they're going to go to maybe where there's another opportunity. So that's super important. And folks are more likely to stay when they feel like promotions are done fairly and consistently. So if you say, hey, if you want to be a BMET 3, but you need to specialize in anesthesia or respiratory, that's a fair, clear-cut way to say this is how you get your promotion. So this is what that can do. And then as you talk about whether they're ready to move now or in 1 to 2 years or maybe never, that's in red, you can color code them and see who on your staff is promotable right now if you had to promote someone. But no one should be in a panic when your top engineer wins the lottery and doesn't come back to work tomorrow. You should start thinking about what is your plan for everyone there. It's good leadership practice. Al Gresh and I actually did a whole summer tour a couple years ago about succession planning and did a 3-hour presentation all across the country about it. So if you want to learn more about succession planning, we can definitely revive that presentation if there's an interest in that. We have the HTM training guide. This is another way to standardize and create a pipeline. If you have volunteers, trainees, a brand new green BMET or a student, this is a great way to make sure they meet all of the minimum competencies. It's based off of our BMET apprenticeship in the core competency guide that we created. So definitely go through this. It's scalable too. It's about 12 pages worth of competencies. But if you have someone for just a couple months, you can maybe do a few pages of it, but it's really scalable, and we're making sure that everyone meets that same knowledge competency to be working in that entry-level job. We want to make sure that folks are trained and that we aren't just desperate and throwing people in to fix equipment that they may not have been prepped or trained on. The HTM, and I have samples of all of these at the AAMI booth, so if you want to come see them, come stop by the table. Please don't take them though, they're AAMI samples. I only have one copy of each. If you're a member, these are all free to download, and some of them are free to everyone, regardless if you're a member. So please don't take my samples. And so the HTM retention survey and guide, this showed, we wanted to really understand, thinking about all the retirees coming down the pipeline, how do we get people to stay where they are in your organization? Because you don't want to lose people as well. So people often say, like, I'm a millennial, that we don't care about the money. According to that survey, that's absolutely false. So the number one thing that everyone wants is fair pay and benefits. And what we did was we parsed this data. So this is the overarching data, right, about what drives people to stay or leave their current jobs. We also parsed it by gender, we parsed it by race, we parsed it by age group, and we parsed it by job title, so the technicians versus the clinical engineers versus the manager. No matter how we broke out the data, the number one in every category was pay and benefits. So before you can talk about anything else, you need to make sure people on your staff are being paid fair and appropriately for the work that they are doing. That's the number one way to upset people, if they feel that they're underpaid. And then again, that fair and consistency. So, and then as you looked at the different groups, and this is all online or at the table, the 2, 3, and 4s changed though, between the females and the males, between the BMETs and the clinical engineers, and between the different races as well. People wanted different things. So, when you're thinking about how you're working with your staff, it's not always a one size fits all when it comes to retention, is the takeaway from that. Everyone has something different. And, when we talk about these succession planning guides, part of that is sitting down and having those conversations with your staff. Or if you're not a manager, having that conversation with your manager about what matters to you. PM compliance and definitions guide. I think this is one of our most popular guides that we've created. So when the Joint Commission and CMS came out and said we had to have 100% completion, we all knew that wasn't possible. With nurses putting pumps in the ceiling tiles, hoarders, all different things like that, it's impossible. And especially during COVID, I think we saw you can't take ventilators or essential equipment off of patients, and we saw people on those pieces of equipment for a long, long time. So how do we deal with those scenarios? This guide goes through all those common scenarios and how it should be documented. So this guide clearly talks about there's a difference between 100% PM completion and 100% PM compliance. Those words are very different, right? You cannot have 100% PM completion, but still be 100% compliant. So if you have a patient that's on a ventilator and you can't get to that vent because it would be detrimental to their health to take it off. Sorry, my throat is like so dry suddenly. And it would be detrimental to take that off of the patient. If you go and if you've gone and tried multiple times throughout the month and you have clear documentation, the regulatory bodies will accept that. So it's really looking at what you do in those one-off situations. Like for instance, a PM comes due, but it's out for vendor service. You shipped out the pump. How do you handle that, right? This goes through all of those different scenarios and how to document appropriately so it meets regulatory requirements. And this has been vetted by the Joint Commission. So they were okay with everything that is in it. We also did the emergency preparedness guide. Actually, Mike Bustiger helped us write this. back in, what, 2021, we found that not all HTM departments were created equal when it came to emergency response and emergency management. During the pandemic, you know, we got a lot of calls about what should we do about this and that, PPE. And there was one question that had come up that was very peculiar. And I said, you know, this is AAMI stance, but you need to run it by your emergency manager. And the person, I remember, I'll never forget it, said on the phone, what's the emergency manager? Who's that? And I was like, how do you not know who that is in your hospital? Like, and it just really showed that not all HTM departments have a good emergency preparedness plan. And much like succession planning, you shouldn't be planning in the emergency. You should have a plan if something were to happen. We all worked up in Boston when the Boston Marathon bombings happened. You know, obviously with a mass casualty event, you had, I mean, with the influx of people, all the resources, you know, just trying to really help, not knowing how many people were injured, setting up annex ERs and things like that. So you have to be prepared, and you never know what's going to happen. You know, and you know, it could be a hurricane, an earthquake, depending where you live in the country, wildfires. There's so many different things that happened. And this is based off of the FEMA checklist, and what we did was we HTMized it. So, you know, knowing where your emergency response area is, who reports from HTM, do you even have an updated contact list? You know, if there's like an active shooter event in your hospital, you don't want your staff coming in, you want them staying away, right? But you need to know how to get in touch with your staff to be able to do that. So just making sure that you have all, like, is your emergency equipment been checked in those things? So this goes through everything. Definitely go through it, review it with your department, and make sure you're ready to go. CMMS collaborative, white papers. So we all need to be singing from the same sheet of music. And if you didn't document it, you didn't do it. And when we think about making big decisions in HTM, if we don't have good data, we can't make good decisions. So one of the things we did was optimizing the CMMS failure code. Al was part of this group that worked on this. And what we did was we gave 13, so 13, Al? Roughly 13 failure codes. So when you're doing preventative maintenance on a device, how are we coding that? Just saying failure is really non-specific, but if you say battery failure, now we're looking at something totally different. If you're PMing 100 infusion pumps and 50 of them have a battery failure, maybe that's indicative of a poor design or a recall on the battery. So the more specific and better we're documenting in our CMMS, the more responsive and better we can be to help. And then we also looked at the work order field type. So looking at corrective maintenance, preventative maintenance, cybersecurity, project management, things like that, because we know we do way more than break fix. We bring so much value to healthcare systems, but if we're not documenting it and we're not showing a case to senior leadership, we're not going to get new positions. They're not going to see our value. So it all comes back with documenting. If you find that you're spending 80 hours a week just on cybersecurity, maybe that's indicative that you need a full-time cybersecurity person in your HTM department. So just looking at things like that through proper documentation. Gray areas of equipment service. This was another Mike Bustiger project. Mike was on a roll for a couple years for helping us write documents. So what we did was we surveyed 175 hospitals, and we looked at, you know, the most questionable pieces of equipment. You know, we've all been there saying this isn't a medical device or this is a medical device. So this document took about the 50 of the most commonly questioned devices, and we surveyed 175 hospitals to say, who's servicing this in your department? So this is not meant to be prescriptive. Obviously, you can, if you want to service refrigerators or microwaves, you totally can, but this is giving you data to say, okay, 90% of hospitals are not doing microwaves. Maybe we need to get this off of our responsibilities. Or maybe when you think of UPS imaging systems, 81% of HTM departments and hospitals are servicing those. Maybe that's something you want to justify to your senior leadership to say we should take this over. So again, we're not saying what you should and shouldn't be servicing, but this can help you if you're trying to take a justification to senior leadership as to what hospitals across the country are doing or not doing. The other thing that's really important was we worked with the Joint Commission again, and what we did was we classified every device here that is in a gray area. So for instance, let's say you're servicing exam tables. The Joint Commission views that as furniture, not a medical device. So what that means is because it's not classified as a medical device, it technically doesn't fall under your MEMP. So you don't have to necessarily PM it once a year. You can if that's your internal policy, but the Joint Commission is not looking for it that way because they view it as furniture, not a medical device. So make sure if you are responsible for, obscure devices, they all don't need to be on a PM cycle necessarily. And again, I say that with caution. Don't just start taking stuff off of your PM schedules. You need to go through your environment of care and make sure your hospital is okay with that. But per the Joint Commission, that is okay. The HTM levels guide. So this is another way to really elevate your HTM department. This was recently updated, and it has 11 different categories, and they ask you a series of 35 questions. And what you do is once you answer those 35 questions in the 11 categories, it'll rank your HTM department from 1 to 5. And it'll rank you in each category from 1 to 5. So it's really hard to get a 5, but most HTM departments will get a 3 or 4. But it really helps you benchmark yourself against other hospitals in the country. I can tell you, in order to get a 5 in every category, someone is doing that somewhere. It's not an unobtainable request, but not everyone is doing everything at the 5 level. So this is how we slowly elevate the field. And what I say is if you're taking this survey, it's completely anonymous. We don't share who's taking it or what health system's doing what. But, even if you just have, let's just say you scored a 3 in category 9, getting from a 3 to a 4 is a huge achievement, even if you don't move your overall score. So you can align that with your, goals for the year, your HTM department goals, and that can be something that can really help elevate your HTM department. Seen by the C-suite, again, this is really a way to just garner the respect that you deserve. Part of the discontinuity sometimes between HTM and the C-suite is they just don't understand what we're doing, and it's really about being present and speaking the same language. So this helps, gives you tips on how to get there. And then we have non-technical skills guides. Sorry, checking the time. Non-technical development guides on building trust, leading strong project teams, and financial acumen. Those are all free to our members as well. And then we have our career and leadership development guides. These are, if you're new to the field or you're looking to move into management, these 2 guides are really great. It gives you a step-by-step process. I'll be teaching a course on these starting in 2026 about these guides and how to get your career to the next level. So if that's something that interests you, please let me know. We also have cybersecurity resources. We have our cybersecurity guide, medical device. We have a page for cybersecurity resources, and we have an agreement with CompTIA that if you want to do any of their courses or certifications that you get 20% off. The BMed apprenticeship. So this is one way to help promote the field and create a strong pipeline. So in 2021, myself and about 80 other HTM professionals helped develop and write the curriculum for apprenticeship specific to being a BMed. It's a 2-year hybrid program or 4,000 hours with supplemental learning. And what we wanted to do was we wanted to give everyone an opportunity to become a BMAT regardless of economic status, where they are in their lives. Not everyone has the means to go to college, depending where they are in their lives, or maybe ever. So, we have a lot of career changers. We have a lot of green people coming in the field. We have BMAT academic programs closing. So how do we ensure that people are trained consistently into a minimum competency? This does that. And we have, and what I do want to say is we have over 3,000 people that want to do this program. So if you can't find people, AAMI has your pipeline. So if you're interested in being part of this and partnering with AAMI, there is no cost to partner with AAMI to be part of this program. We would really love to have your hospital or third-party servicer or OEM business to be part of this program. We want to develop a huge field of BMETs, and this is really a fundamental way to do it. So when you think of apprenticeship, you often think of plumbers or electricians, but there's actually 240 different occupations that have apprenticeships, from winemaking and everything under the sun. And this is a great way because BMETs can really be trained hands-on on the job. So it consists of a paid job. You are required to pay them 40 hours a week. You don't necessarily have to pay them benefits. You can hire them as temps. So that's one cost to you as the employer. And when we say assuming they're full-time, it's 2 years. If they work part-time, it's 4,000 hours. So however long it takes them to get to the 4,000 hours. They learn as they work. So there's a competency list that they'll go through, and they'll be paired up with a mentor, and they'll check off all those different competencies as they're learning. So it's pretty much learn on the job as you go. You can have multiple mentors. And then there's a formal learning. So the Department of Labor requires that you have to do 144 hours of additional learning each year. AAMI has outlined that for you, and it comes out to about $3,000 over 2 years, so $1,500 a year. So those are your costs. So it's relatively cheap, and it's a Department of Labor rule that you have to pay for their education, not an AAMI rule, because the point is that they're getting transferable skills, they're building a career, but they got to come out debt-free. So it's their salary for 40 hours a week, which would be under that of a BMET 1. Benefits are optional, and then it's $3,000 over 2 years. And it's all non-duplicative. So for instance, we require 2 college courses, math and anatomy and physiology. If most of the people that do this program are career changers, and they've already taken a college math course. So if they have, and if they've passed it, you don't have to repeat that. So $3,000 over 2 years is worst case, depending who you hire and what they may have done in their past career or past education. So it's not really that expensive. It's a great way. And at the end of the 2 years, they get a certificate from AAMI and the US Department of Labor, similar to a college degree that's good for the rest of their career, to show that they have gone through formal learning and they've met AAMI's competencies and standards. Yes. Yes, that's later in my presentation. It's, I can't announce it to the 18th of November. Okay. Mm-hmm. Program, the states, if you go to the states and take a look, a lot of them will provide grant funding. And the GI Bill can be used for some of this as well. So yeah, so it's even, so that was worst case, $3,000 over 2 years in their salary, but some, depending what grants you can find, if you have a veteran, it could be, and if they've had past education, it can be cheaper. So these are some of our partners. Oh, I have to swap out Crothel, they're in TELUS now, but these are some of our partners right now. We've had about 10 people graduate from the program so far, and we have about another 50 enrolled, and about 30 employer partners total. And we do a graduation at AAMI Exchange every year. They get to walk across the main stage, and we hand them their diplomas. So it is really an honor for them. And then CEUs, so for those, how many of you guys are certified? Oh, awesome. Well, come by the AAMI booth. I have a CBET, CHTM, CRES pins. And if you are a veteran, I also have veterans pins. So come by and please get a pin from us. And if you have multiple of those credentials, I'll give you multiple pins. So, but one thing I did just want to tell people, the biggest complaint I get at the AAMI table or the AAMI certification line is that my employer has no money, I can't travel to get education, and I can't renew my certification. I'm here to tell you that is completely false. I also have my CHTM. I also have to renew it every 3 years like you. I do not get a free pass because I work for AAMI. I have to do my education and submit it, do the CEU journal. So I understand and I feel your pain too as well for having to do that. But between AAMI, MD Expo, TechNation, there are so many free webinars. Fluke Biomedical has their Advantage training. There's so much free content out there. Even the bearded biomed, Chase, has an LMS now, and many of his podcasts are worth a CEU if you listen to it and you get certificates. There is no reason you should let your certification lapse. Worst case, you have to watch 25 webinars. I know that sounds boring, and but if you think about it, it's over 3 years, right? Being here, you get CEUs, so you have to do less of that. But worst case for anyone, if they cannot travel, if they have no travel funds, we have free webinars at AAMI, MD Expo, TechNation, OR Today. So please don't let your certification lapse. You get 4.5 CEUs just for working full-time in the field for 3 years. So deduct that, that leaves you with 25.5. So, it's easier to get that than you think. It's about 10 hours a year. So if you have questions though, please come see me at the AAMI table. If you're curious when you're due to renew, if your certifications aren't aligned, if you have like your CBET and your CHTM, we can make them aligned so they're due to renew on the same year. That way you'll have to enter your CEU journal once. Because if you have 2, you don't need 60 CEUs, you still only need 30. I just want to make sure people realize that. So, and you submit it all at once. So if your certifications aren't aligned, let me know. I can align them for you at the AAMI table. Let's see, so we do a big event every year called the AAMI Exchange. You've probably heard of it. It'll be in Denver this year, May 29th through June 1st. It's earlier this year. And we had a really successful AAMI Exchange 2025. We get about over 2,000 people, 70 education sessions, and we had a record. We had 173 vendors on our expo floor last year, which was a record for us. So we are very excited. For those of you that didn't hear, I see Darren in the back. Dental is now going to be part of the AAMI Exchange, dental servicing. We're going to have a dental pavilion with dental vendors, dental servicers, manufacturers on our floor. We'll be doing a sterilization pavilion as well. So we just want to keep growing and expanding. And one of the big strategic reasons why we absorbed the dental conference that Uptime, it's actually sponsored by Uptime Health, that Uptime Health always did, is because, dental care is healthcare and dental servicing is HTM. So there's no reason to have it siloed. And I think we can do a lot of good by bringing the two communities and those subset communities together. So hopefully we'll see you in Denver. And then when we talk about promoting the field, AAMI has created a lot of free materials free to use. These are free for everyone. You don't need to be an AAMI member. We created HTM in a box. This is 3 pre-made presentations for 3 distinctly different age demographics. So the middle school presentation is very different than the college presentation. It's geared towards the age that you're presenting it to. So, we wanted to take away the work of creating a presentation. So now you don't have to. You can just set up a presentation at a Boy Scout, Girl Scout troop, a HOSA event, or a high school or middle school, and this is all made for you. And I do update it yearly with the updated statistics and stats. So it's always getting updated. So you can get that by going to aami.org/HTM in a box. We also have free promotional brochures. So we have the Managing Technology Saving Lives, and then we have a children's one that makes HTM look like superheroes. We have tons at the AAMI office. If you just email me, we'll ship you out a stack, and we can get you on your way to promoting HTM. We also can send you swag. So, and we have a lot of other stuff. We have the complete school listing. So if you're presenting and you're not sure if there's a school in the state you're presenting in, we have all that. I just updated it all last week, so it's all current. We also have an FAQ document that you can print yourself on an 8x10 paper, and that's the academic school listing. And then one of the big things that we're really proud of that we did actually back in 2024, but because the government's really slow to implement stuff, it just got implemented right before the government shutdown, which I feel like was a huge win because it would have never gotten implemented for a long time if that didn't happen. But a group of about, 30 of us, Mike, we were working with the Bureau of Labor Statistics, and we wanted to get the medical equipment repairers job description updated on the Bureau of Labor Statistics website. It was very archaic, very outdated, didn't represent what BMETs do today. So we completely rewrote it, and it just in 2024, and it went through multiple government committees, and in must have been October. In October, it finally passed and went through, and this is now updated and current. to really show what BMETs do every day. Because we realize too that this may be their first and only interaction with the profession, and we want to make sure that it's robust and exciting and people want to do it. My long-term goal before I retire is to get this title changed from medical equipment repairers to biomedical equipment technicians. But the first step was getting the description updated, and then we can suggest that. So, but unfortunately, because it took them so long, that they just did a call for new titles, job titles, and we missed that, and the next one won't be till 2037. So, so hopefully before I retire. So, but you know, at the end of the day, though, I feel like if we got to update one part, the description is more important than the title, because if the description's really exciting, people will still want to do it. And it does have in the description under when the first line says medical equipment repairers, also known as biomedical equipment technician. So it is in there. It's just not the title, the formal title when you look it up. We've also been working with HOSA. So HOSA is the Health Occupation Students Association, the future of health professionals. If you've never heard of HOSA, it's an association for students that are interested in careers in healthcare. They have chapters in 49 out of the 50 states. Montana is the only state that does not have a chapter. And high schools can, you know, work with their state chapters and become HOSA members. Probably no surprise to all of you, there was no HTM specific track at all. We noticed this back in 2020, and we've been working with HOSA for the past 3 years. And step one was we sent out this poster to all 500 high schools across the country that have HOSA chapters and reached about 600,000 students. You can see there's 2 technicians there, and can you see yourself here? And we're also excited to announce that this past September, we launched an official BMET track. It's in a pilot status, but we have 160 students doing it and 7 states participating in it for their national and for their statewide competition. So please help us. If you know a high school nearby that has a HOSA chapter, please let them know we have a BMET track now. AAMI has donated their BMET 101, and we've been working jointly with the College of Biomedical Technology, and they have donated their entry-level MET course, medical equipment technician course. These students go on and they do 2D immersive VR on the computer, watch lots of videos, and they learn a lot of information about our field. And then they go to the regional or state level competitions and compete. They are given a test, and ones that do well go on to nationals. So we're very excited. It's a way to really spread our field and occupation as early as a freshman in high school. And we're just hoping that we can get more and more high schools involved. So anything you can do to help us, please let us know. Yes. And that's where they compete as well. Yep. And that's what we're looking for people to do. Obviously, I'm one person. I can't be at every competition everywhere at every event. I would never be home and or do any work, I guess, if I was always traveling. But yeah, so what we're looking for is even for the states that aren't doing the BMET competition this year, to still have someone there representing HTM to say, hey, we have a track now to spread awareness. They might not know we have the track. And just to answer questions about the career field itself. And for states that do have the track, just to have people there answering questions, because a lot of the parents want to know, like, is it a, you know, is it a lucrative job? Is it rewarding? Tell us more about it. So they can also come and talk to us. So if you can get involved with your state or regional HOSA chapters, it would be greatly appreciated as we grow this and roll it out across the country. And then we also have our HTMA collaborative. So this is what AAMI wanted to do, was create a community of all of the local HTM regional associations and their leaders. So you see Webb, Ryan, Jason, and Samantha, they've stepped up from their associations and they work with me closely. And what we do is we want to bring together all of the association leaders to talk about challenges, figure out how AAMI can better help support the regional associations, And what they wanted to do was, there's a lot of states or areas that don't have a regional HTM association. And there's areas that MD Expo or AAMI don't ever go to. You know, we're not going to have a conference in the middle of the desert in, I don't know, or like in Montana, right? That's really not somewhere where we would do an event. But those people never get something like this, right? So how do we bring it to them? So all the HTM associations stepped up and said, let's do an HTM collaborative webinar series. So every month, a different HTM association organizes the webinar. AAMI does all the back-end logistics, the registration and everything, but we put this out. It's free for everyone, and it's been really successful. We've done 8 webinars now. We're very grateful to all the regional HTM association leaders for stepping up and doing this and working with us. And it's another way to get CEUs. So hope it will continue into 2026. And for any of you that have been a part of it, thank you so much for your support. And then here's just some pictures of people out promoting the field. Nothing makes me happier than getting photos of you all out in the field using our materials or HTM in a box. And then we've also done a lot of other work with different types of articles that we've taken out in USA Today, the High School Guidance Counselors Associations, the Girl Scouts, Boy Scouts. We've worked with a lot of different organizations to help spread the word about HTM. And that's it. Are there any questions?